In this presentation, I'm looking at treatment strategies that transcend our standard diagnostic ideas. Because if one can find such ideas that are independent on the style of acupuncture one uses, then one can use these strategies whether one uses TCM, Tong, Wang Juyi, meridian therapy, palpation confirmation, or whether one uses traditional or modern medical concepts in diagnosis. Although we can vary widely in our diagnostic methods and analysis of conditions, most practitioners try to get at a diagnosis that in some way or another will translate to a predominance of one of the organs or so-called elements. This is true whether you are a TCM practitioner looking for excess and deficiency, hot, cold, damp, chi, blood, and then which organ is involved, or whether you are a 5-element style practitioner, or even if you use modern diagnostic language like thyroid or ovarian hormones and functions. Some will say that they are not looking at organs, but rather at channels, be it by trying to balance an issue in one channel by a related channel, as in the balance method, or by diagnosing channels through pulse or palpation. We do that as acupuncturists so that we can more easily pick up a channel or points to be treated. We need to narrow it down to a channel and points. But are there treatment strategies that come before looking at the organs or specific channels? I would like to make the case that there are issues that should be addressed regardless of our usual diagnosis, and that prior to treating any other diagnosis, regardless of the diagnostic style we use, that they take precedence over our usual methods that seek out a way to pinpoint a channel or a set of points. When we address these, we not only provide the space for the channels and organs, we will enhance whatever other treatment strategies we then use and make those last longer. The first of these, the first 4, are related to opening the 3 diaphragms: the throat, the pelvic girdle, and the chest diaphragms, ensuring that there is Chui, the activity of the legs, is at the root of the perineal diaphragm and supports everything else. Relaxing the frontal brain, or activating the back brain, creates a more reptilian or relaxed nervous system and provides space for healing. Undulating the spine also smooths out the nervous system, as well as the hormonal system, and ensuring circulation is paramount to the success and longevity of any treatment, addressing the lungs and the heart, ensuring qi flow. Before there are channels, which are made to reflect the 5 organs, and before there are 5 organs, there has to be the space in which they operate. Before the division into 5 or 6, there is the trinity of 3, of heaven, person, and earth. The human, and the space of the human condition, is that which reaches and mediates between heaven and earth, providing the interaction of yang, heaven, and yin, earth. When that is established, the interaction of yin-yang can then be further articulated, and it is then differentiated as the 5 phases, the organs, the channels, etc. But before that, there needs to be the basic connection of heaven and earth that creates the space for the human. In establishing this connection, this movement between heaven and earth, there is the utilization of the 3 diaphragms, creating the 3 cavities of the skull, the chest, and the abdomen. The diaphragms modulating the pressure, the connection between them. These are the laryngeal, the chest, and the pelvic or perineal diaphragms. They create the space and modulate the pulsations, the rhythm of the body. ensuring the proper working of these areas of the throat, the chest, and the pelvis, that they are engaged, yet free and open, is often a priority that takes precedence over treating the organs or the channels, because a disruption in these will contribute to a weakness and problem in the organs and meridians. Releasing and establishing proper tone in one of these areas, one of these diaphragms, will tend to affect the other two. They are interdependent entities that affect each other. For the sake of clarity, I separate them into 3 distinct entities with distinct treatments. But in practice, it is common to see that addressing one diaphragm will address the others, and determining which area should be addressed first will depend on the holding patterns of the patient. Because the throat has the strongest relationship with the nervous system through the vagus nerve, I am opting to start with the neck and throat, but this is not a clinical rule that must be obeyed. Tightness in the laryngeal diaphragm, tension in the neck and throat can interfere with the communication between the brain and the body. Tightness in the SCM congests the vagus nerve and deprives the body of parasympathetic input. The phrenic nerve that comes out of C3 and C4 affects the chest diaphragm and therefore affects both our breathing capacity, hence the quality of circulation, as well as the nervous system through the chest diaphragm. The scalenes, being breathing muscles, also affect the nervous system, and tightness in the scalenes can result in tightness in the whole body. My own assessment of these is to palpate these areas in the neck and the throat, and then release the tensions that I find by palpation. However, in this presentation, I'm trying to offer ideas that are independent of one's diagnostic methods or acupuncture style, in my case, palpatory. Luckily, the scalenes and the SCM are quite visible when tight, so you will see the tension here. The advantage of palpating these areas is twofold. First, you get a better assessment. Before anything shows visually, it will show tightness. And secondly, you get to test your treatment points by ensuring the release of the pressure pain you found on the SCM and the scalenes. People with tight jaws, which is often also visible, will often also have tightness in either the SCM or the scalenes, as well as possibly in the cervical region. Here is a caricature of a tight throat. These are the Kardashians from Star Trek. They are the sci-fi Nazis of the 24th century, a species known for their anger and short temper. They have thick and tight necks that immediately suggest their anger. Let's take out their facial features. We still get a sense of uptightness just from the neck. We can see that the neck reflects the nervous system. Even if now we impose a cute smiley face, there is still something a bit menacing in them, and the face clearly does not belong on this neck. I cannot say that there are clear pulse associations with this pattern, but then I am not a very precise pulse diagnostician. I am sure better pulse people will be able to make that association, but unfortunately, since it takes many years to develop the skill required for that kind of pulse reading, and also some time and effort to develop one's confidence in palpatory findings, generally, most of us will tend to not do both at a level where we can cross-pollinate our findings and translate these systems fluidly. In more general terms, I can say that tightness in the SCM and scalenes do tend to have some sort of tightness in the pulse. However, I cannot offer a more precise quality of positioning, and I also cannot say that a tight quality in the pulse automatically indicates that releasing the SCM will undo the tightness in the pulse. But if you are a pulse person and have clarity about changes in the pulse, when you touch or needle a point, you may want to play with this idea. Symptoms that typically require releasing the throat and neck are pain in the neck and shoulders. Sometimes arm pain can be related to congestion here, especially in the scalenes area. Digestive issues commonly require releasing the SCM, as digestion is highly dependent on the vagus nerve and its input. Neurological disorders, ranging from stroke to head injuries and brain damage, all tend to have tightness here also. Anxiety and depression are also often accompanied by tight neck and throat. Male urological issues are often related to tension in the throat and the neck areas. In women, this tends to be a little bit less pronounced. In men, especially, sex requires strong cooperation between the sympathetic and parasympathetic nervous systems, so that both arousal and relaxation can take place simultaneously. Releasing the SCM remotely and then needling it around stomach 9 is the primary treatment of choice for urinary blockages post-surgery. This demonstrates the connection between the perineal diaphragm and the throat diaphragm. If we cannot support the spine from our core, which means supporting the pelvic diaphragm with the inner thighs, the shoulder and neck will try and take over and will result in excess tension here. It is because the neck is like an extremity in this case, and the pelvic floor is much more central. So when we lack the lift in the pelvic floor, which requires very little in terms of muscular tension, we utilize the neck and the shoulders to keep us upright. But this is a bit too remote now, and it requires much more muscular activity. The points used to release the laryngeal diaphragm are Sanjiao 8 to release the SCM. Sanjiao 8 is located about 1/3 below the elbow. If you slide your finger lightly up from the wrist, it will stop at Sanjiao 8. The point is best needled not perpendicularly, but at a slight angle towards the small intestine channel. Sometimes Sanjiao 5 will do a better job in releasing the SCM. This is somewhat more typical for patients with a rapid pulse. I take Sanjiao 5 in the regular textbook location. The needling angle is also slightly towards the small intestine channel. To release the SCM, use the opposite side Sanjiao 8 or Sanjiao 5, although the same side can also release the SCM. To release the cervical area in the back, use the Sanjiao points on the same side as the neck area you are releasing. Kidney points, either kidney 7 or kidney 9, also release the neck. Both the SCM and the cervicals, and to some extent the scalenes as well. The second branch of the kidney channel follows the larynx and throat and presses the root of the tongue, homing to the hyoid, reflecting the pubis where the first branch homes to. The kidney meridian supplies the support for the activity of the legs, the chuai, and for the spine. When this activity is lagging, the throat will tense up in an effort to supply support from the top, the neck, as compensation for the support that is lacking from below. Inner yin is level with liver 9, but on the kidney channel. This is where the action between the leg starts the lift of the pelvic floor and the support of the lower abdomen and the spine. It is therefore involved in releasing all the diaphragms. This point specifically is known to release the trapezius, but also the scalenes, and it can usually release any area of the neck. Spleen 3 is specific to releasing the scalenes. The spleen channel is also involved in creating the chui, the up and down movement of the leg which supports the spine. Spleen 3 is named Tai Bai, the Great White. Bai is the sun that is just rising, hence the pale, white, or clear color of just rising sun. It connotes a rising, an upward movement that is initiated from the transverse arch of the foot. Pressing down on the spleen 3 area supplies an upward movement of the legs and support for the spine. The spleen channel, along with the kidney and the bladder channels, is one of the channels that are described as having chui, an essential component to creating the core of the perineal floor. The spleen channel has a strong affinity to the throat. The channel is said to squeeze or hold the larynx and then disperse below the tongue. It also has a unique connection with the chest, where its second branch pours into or concentrates at the heart center, a unique designation reserved only for this channel. For some people, spleen 9 is preferred. Spleen 9, Yingling Chuan, refers to being able to lift. Chuan is a fountain, lifting. Lifting what is accumulating downwards with gravity. Ling is a mound, an accumulation. Yin Ling Chuan. One often sees a sort of chubbiness, a dropping down at spleen 9. Needling this accumulation, this chubby flesh, from just below the tibial trochanter up towards the knee, also sends an upward postural support, a signal to the body, and it can release the neck. Although spleen 9 is especially known for its effect on gallbladder 21 area, it can be useful for any area in the neck. It might be the better choice over spleen 3 in some patients, or in some cases it may be used in combination with spleen 3, creating a better effect with both points. Bladder 2 represents the upper dantian. Its effect tends to be on the back of the neck and on the levator scapula. It also releases the diaphragm and the upper abdominal Ren line, that is Ren 12 to Ren 15. Because it relaxes the brain, it can be thought of as a sort of non-TCM yin tongue. It has a secondary effect of releasing the throat, but usually it will be a supporting point for that. When we look at the pelvic floor, the perineal diaphragm, we have to look at the legs, because the legs support the lift of the perineal floor. Most people think of core strength as something like Schwarzenegger's abdomen, the famous six-pack. They will also point to their navel and even above. This is quite misleading, because one can have an amazing bodybuilder shape and have absolutely no core strength. Compare the two images, the bodybuilder and the dancer. They each represent a totally different use of the body. The bodybuilder is highly unlikely to be able to find balance the way the dancer does, and the dancer clearly does not have the bulk that the bodybuilder has, and yet she also clearly has strength of a very different nature. A core is not just the center in terms of space or gravity. It is also the center in terms of action, of focus. Cores are therefore often hollow. The activity in them is minimal, supporting with minimal action great forces around them, moving them, balancing them. Think of the core of an atom or the calm center of a hurricane. The human core is the perineal floor. The perineum is at the very bottom of the torso, but it is also between the legs. Notice that the pubic bone is below the lesser trochanter of the femur. Part of the bladder and the anus, and more importantly, the perineal floor muscle, the levator ani and the coccygeal muscles, are at the level of the top of the thigh. They are between the legs. These muscles that form the pelvic floor, or the pelvic perineal diaphragm, are quite small and are attached to a self-contained circle of the pubis, the ischium, and the coccyx. They are very hard to activate through moving them in space. However, they will get activated when the inner thighs are activated. The pelvic or perineal diaphragm is activated when we activate the muscles in the inner thigh, say halfway up the thigh. It is as if there is a straw between the legs, which is being sucked up the inner leg into the perineum, creating the activity of the perineal diaphragm. From here, imagine that the straw is sucked just in front of the spine, supporting the spine all the way up to the throat, providing support for both the chest and throat diaphragms. In the yogic traditions, these are called the bandhas, locks or bridges. The mula, the root bandha. The uddiyana, the upward flying bandha, supporting the spine. And the jalandhara bandha, the throat diaphragm. Jalandhara means holding water, the ocean of life, and associated with bringing one back to the source. In pranayama practices, it is used to keep the prana within the body cavity. The important point here is that these three diaphragms, starting with a perineal diaphragm, are physically created by the use of the legs. Look at this surfer. He is engaging his core so as to find balance when riding a wave. You can see that this engagement involves the legs. It is as if he's sucking up the inner legs, gluing the board up into his feet, continuing the action into the abdomen, which now hollows. This is not sucking the belly hard into the spine, but a softer hollowing that creates space and strength at the center, allowing one to surf with strong winds and strong waves. It is a much softer action than the bodybuilder's abdomen. Rather than a contraction of the abdominal muscles, it allows for space in the abdomen. It has this strength, but it is fluffy, meaning it is soft and spacious, not congestive and contracting. So before we can create the core, the space, the hollowness of the lower abdomen, we need to establish the activity of the leg. This is chui, to kick or stomp. It is sending the foot down in order to create an upward motion. You send the heel down, and that results in an upward vector up the inner thigh. The famous saying, "What goes up must come down," is also true in reverse. What goes down will cause an upward motion. Ling Shu Ten describes the kidney, the bladder, and the spleen channels as involving chui. These are the channels that are responsible for creating the specialization of the leg or the foot in creating a downwards and upwards interdependent vectors. When we send the heel, the calcaneum, down and lift the inner ankle away from it, the medial malleolus, away from the heel, we are separating the tibia from the foot, resisting gravity's downward pull, activating kidney 6. Kidney 6 is named Zhao Hai, to shed light or to illuminate the ocean. The ocean is the ocean of life. By activating kidney 6, I now illuminate my life as an upright being. Most of us simply do not use this action, and we allow the weight to just drop down through the legs. We can afford to do that because the bones stack us up on top of each other, and then they keep us upright, even though there is no active vector created to support this. We are used to being over our legs, and we are used to our legs being lazy and not actively supporting us, and we get away with it. But what happens when we stand on our hands? When we stand on our hands, we are on much thinner limbs with less mass supporting it, and we no longer have the habitual pattern that is not afraid of falling without resisting gravity. When we are in a handstand, we have no choice but to push down into the hand in order to lift away from it. Otherwise, we will fall. Chui is supposed to involve the leg. The leg or the foot is part of the character. But the action exists in the arms also, pushing us towards heaven with the arm, pushing down towards earth with the leg, creating the space for the human. So while the Ling Shu does not specify Chui in any arm channel, when we look at handstanding, we can see that there is something very similar to Chui in the pericardium channel. And we see pericardium 1, Tian Qi, the heavenly pool, is where the energy, the vector of heaven, pulls into. The Chui, the action of pushing down to grow up in the legs, is what establishes the pelvic floor. It allows us to resist gravity and supplies the support for the abdomen and the spine. Without it, the organs of the abdomen and eventually of the chest get congested. The posture slumps, creating tension in the neck and the shoulders. Patients who sit with their heels off the floor and have an anterior tilt of the pelvis when standing, or a general visible heaviness in the legs, almost as if they're shuffling the feet or throwing the feet forward as they walk while the pelvis lags behind. Those are the ones who do not have Chui action. They will often sit slumped in the waist and the pelvic areas, rolling onto the buttocks rather than sitting on the thighs and sits bones. Their symptoms or their pain patterns will improve when you ask them to tilt and put the weight on their thighs, even pushing slightly down with the inner thighs into the chair. And then also when they send their heels down into the floor when standing. Typically, this type of patient will have tension or pain in the upper back, shoulder, or neck, but they can have pain anywhere in the body that improves, at least momentarily, when they activate the legs. The tension in the upper body is created because the core, the lower support, is lacking. The body is attempting to lift up from the upper part, and now a much greater muscular strength is needed. The action needed to support the upright posture in the heels and the legs is very minimal. It is by far more a brain pattern than a muscular pattern. But when it is missing, a lot of muscular tension compensates for its lack. This is what happens when there is no activity or awareness in the legs. Everything drops, including mood possibly. Points that are used to help create the sense of Chui are kidney 6 or kidney 7. These represent the Chui that Ling Shu 10 prescribes to the kidney channel. We already saw that kidney 6 allows for the separation of the heel from the lower leg, sending an upward, a light shedding action up the inner thigh. Kidney 7, full yu, to recover the flow, is a point where one can literally feel the downward movement in people who have no Chui. It is as if the tissue at kidney 9 is falling down. The point is needled upwards to help give the body a pattern that has both up and down rather than just falling down. Fu, to recover, tells us that we have to keep repeating the action of stepping and sending down in order to grow up. It is a constant pulsation that needs to be reinforced, not a one-time thing. This is why it is hard for patients to establish Chwai. It is something that one has to continuously generate as a thought pattern in one's posture. On the spleen channel, we have spleen 3, as we saw before, Tai Bai, the Great Rising. If one does not stabilize spleen 3, when one attempts to lift the medial malleolus away from the heel, one is likely to just roll onto the outside of the foot, and then no Chwai is being created. By anchoring spleen 3 down, we prevent that rolling, and now the Chwai is generated into the thighs. Stomach 41 is another point that can generate the separation between the foot and the lower leg, creating the opportunity to generate the Chwai action, a down into the heels that generates an upward motion into the inner leg. The bladder channel is also prescribed a Chwai action by Ling Shu Ten. Here, the points that work best are bladder 36, Chang Fu, receiving or supporting the support. Needling bladder 36 is a reminder to the patient that this is the area they want the weight on when they're sitting, rather than the fleshier gluteal region. Bladder 58, Fei Yang, the flying yang, is another point that can help give a sense of Chwai. With all of those, use inner yin, the point on the kidney channel that is level with liver 9. This is where the Chwai of the foot rises to and begins to create the lift of the perineal floor. It is the beginning of that straw that bubbles up into the perineal floor, up in front of the spine, all the way up to the throat. Liver 9, Yin Bao, the yin wrapping, has a clear affinity, by name, to the bladder and the uterus, to the very lower abdomen and the perineum. But using this same level on the kidney channel provides better support for the lower abdomen and the spine. Once the Chwai action has been initiated, the perineal floor will get activated. To further create space in the abdomen, we can now use side gallbladder 27 or 28. This will be level with Ren 4, going all the way to the side, going below gallbladder 26. Treating the gallbladder channel as if it was going straight down rather than zigzagging down into the inguinal groove. Side gallbladder 27-28 is in the gluteus medius, just below the iliac crest. Look for the tight or ropey feeling here. The glute medius is a posture stabilizing muscle, and it allows for extending, creating space in the torso. It is a little like coming from the side and squeezing in order to create more space, like squeezing the toothpaste tube, elongating the paste and sending it up and out. Liver 4 is a point that also affects the lower abdominal space. Take the point not at the ankle, but go down 1 sun with the liver channel towards liver 3. You will find a dent that feels a bit mushy here. Needle it upwards towards the ankle. This conforms to the description of the point in Ling Shu 2. Ling Shu 2 also specifies that liver 4, needled with the floor of the channel, creates an opening. It is implied that this opening is in the center of the abdomen, because the name of liver 4 is Zongfeng, the seal of, or the authority over, the center. You can also see that liver 4 and stomach 30 at the pubic bone share the authority character. In liver 4, it is combined with a hand to make the meaning of conferring authority. Feng in stomach 30, qi jie, the qi thoroughway. The authority character is inside, surrounded by the stepping han xing character. It means to walk with authority. And of course, inner yin is extremely important, not just to establish the chui here, but to then also further create more space in the lower abdomen. Usually, I will use inner yin with at least one of the lower points, like kidney 6 or kidney 7, stomach 41 or spleen 3, that establish the chui. But there are times when inner yin might serve alone. Once the chui action has been established and the space in the abdomen addressed, it is possible that the perineal floor will not be fully activated. This is because the body has a strong pattern of being lazy in the legs and perineum and compensates with a lot of tension in the neck instead. That is when releasing the neck, the laryngeal diaphragm helps to activate the perineal diaphragm. In such cases, I would use either stomach 9 or the points under the teeth or bladder 2. By releasing the tension from the upper body, that tension, at least for a moment, is no longer pulling you up, and now you are forced to find your core, because the extremity is not doing the work instead. And now the patient has a chance to find the core and engage it, find that pattern. The points under the teeth are under the mandible. Take stomach 4, thereabouts, and slide down, curving under the mandible, and then needle at the fleshy part that is at the base of the teeth. On some people, this area is extremely tight, and that is an indication that it is compensating for lack of activation of the perineal floor. And needling into this tense area offers the body an opportunity to find the pelvic floor lift. Some patients, stomach 9 works better. Some patients, bladder 2 works better. Some patients, the point under the teeth works better. The chest diaphragm is the larger diaphragm, and its movement is far more obvious, as well as the pulsing that it produces. It controls our intake of oxygen as well as elimination through the lungs, but also through the bowels, as the diaphragm's movement contributes not just to the expansion of the lungs, but to the movement of the bowels as well. The movement of the diaphragm also massages the liver and affects blood circulation. The chest diaphragm is a major contributor to the state of the nervous system. Yes, Ujjayi breath, which activates the laryngeal diaphragm, and Mula Bandha or Kegels, which to also tone the nervous system. But they require some training and concentration. Breathing deeply and activating the chest diaphragm can be done instinctively by most people with far less concentration. There are, of course, many people who will breathe with very minimal use of the diaphragm and with a lot of tension here. But even for those people, it is usually easier for them to relate and activate the chest diaphragm than the other two, the laryngeal or the perineal ones. However, releasing the chest diaphragm often requires addressing the throat or the neck and or the pelvis first. A patient who breathes primarily in the throat and upper chest will have tight scalene muscles, and releasing that tension in the scalenes will allow the patient to better engage the chest diaphragm. This softens the body's habitual patterns of tightening the scalenes, and now the diaphragm is invited or enabled to operate more fully. Similarly, if our weight is dropping down into the legs, it will tend to congest the chest also. When we open the hip joint, elongating it, separating the femur and the pelvis, the chest naturally opens and the diaphragm is able to move more freely. We also need to tone the nervous system, the state of which the diaphragm reflects and affects. So that means releasing the SCM and the vagus nerve and ensuring there is no congestion on the phrenic nerve at C3, C4. I release the scalenes with spleen 3 and inner yin, the point on the kidney channel that is level with liver 9. Inner yin also creates the activity of the pelvic diaphragm and supports the chest diaphragm. And by creating the chwai, the down-up movement in the leg, it helps create space in the hip and further open the diaphragm. Spleen 3 with pericardium is a standard combination used to release the diaphragm and the nervous system in anxiety and depression. I will generally choose pericardium 4, 3 fingers below pericardium 3. Remember that the pericardium channel offers the equivalent of chwei in the arms. If pericardium 8 is painful upon pressure, I will instead use pericardium 3 and pericardium 5. Those are the metal and water points to overcome fire. Although pericardium 6 is a famous TCM point to open the chest, I still tend to prioritize the Shi, the opening point, pericardium 4, which I take 3 fingers below pericardium 3 and not in the standard text location. Creating the space in the hip and separating the femur from the torso is accomplished with inner yin as well as with gallbladder 29, which I take just in front or above the greater trochanter. Releasing the SCM for the vagus nerve and C3 and C4 for the phrenic nerve is done with Samjiao 8, 1/3 below the elbow. The point under the third toe also releases the diaphragm and affects the nervous system. This point is known as the blood pressure point. Bladder 2 is also helpful for relaxing the diaphragm, especially when there is pressure pain on the Ren line between Ren 12 and Ren 15. Look for dents about 1 to 1.5 Tsuan lateral to do 20. These can also release the diaphragm. Originally, the use of the left one is to treat the spleen in cases of, say, malaria, and by extension, the right one is a supporting point for treating the liver. But these points also are used to relax the diaphragm. On the back, use Do 2 to release the nervous system, with Do 15 or 16 activating the back brain, and then T7 Huatou to open up the diaphragm. Here is the location of gallbladder 29. Know that it can be in front of the trochanter or above it. You want to get the attachments into the trochanter so as to create space and separation in the hip joint to affect greater space in the chest. And this is pericardium 4, the Hi point. Hi means an opening or a crack, which is why the textbook location of pericardium 4 as 5 Tsun above the wrist does not seem to have as good an opening as 3 fingers below the elbow. If you slide your finger with very light pressure down the elbow, you will feel a dip here. You can see that there is also another dip or opening about 5 Tsun below the elbow, but the location of 5 Tsun above the wrist is nowhere near as clear. And here is the blood pressure point under the third toe. It can release the chest as well as the occiput. Another primary goal for treatment is to relax the brain. Healing requires that the nervous system and the brain are toned, but not tense. This means calming the frontal brain and allowing it to recede backwards towards the primitive brain. This is what a meditator's brain does, literally sending the concentration backwards. One technique meditators use to soften, calm, and open the mind is to slightly tuck the chin in and elongate the back of the neck, opening the occiput. We are all familiar with the idea that the wind invades at the occiput. This is the wind area with points like gallbladder 20, the wind pool, and due 16, the wind mansion. But wind is not just about external wind attacking, as related to the lymphatic glands here. It is also the wind as in the movement of the brain and the nervous system, and the occipital area as a diaphragm, if you like, that modulates the volume of the wind of thoughts. This is why we also see points like due 17, Naohu, the door to the brain, bladder 9, the jade pillow, the pillow being a resting place, gallbladder 19, Naokom, the empty brain, Anmien, the peaceful sleep, and Sanjiao 19, the resting skull. Points that help send the brain backwards, meaning they calm and relax the brain, are bladder 2, as the eyes are a perception organ and hence generate or calm thoughts, and the eyes are also intimately connected with the occipital region. Du 24, Shen Ting, the courtyard of the Shen, the animation, the place where one meets the Shen. In fact, the whole line from stomach 8 to Du 24 can be used, including gallbladder 13, Ben Shen, and one can also go back 2 or even more Zun into the hairline. Sanjiao 22, He Liao, the harmony Liao, that which emphasizes harmony. Here I am referring to the whole area of what we might call the Tai Yang extra point, including gallbladder 6 and gallbladder 7 also. Correct tendons is an area of the Achilles tendons that Master Dong uses to release the occiput and back of the neck. In fact, the area is quite a bit bigger and includes most of the bladder line below the knee and somewhat lateral to it. The Dong correct tendon points are on the Achilles, level with kidney 3 and kidney 7, and I believe there is a third one above it, but the lower two ones are the ones that are used most. Bladder 56 and 57 are named Jiang Qing and Jiang Shan, supporting the tendons and supporting the mountain. Jiang is to support, to receive. Bladder 55, 56, and 59 all have the character Yang in them. He Yang, union of Yang, Fei Yang, flying Yang, and Fu Yang, Yang that is related to the foot, that is exchanged by the foot. All of this whole area, releases and activates the base of the brain, the back of the brain. While it is very important to calm the brain in order to create the space for the treatment and for healing, I reserve the use of skull points as the last set of points to use. This is because skull points can rather easily soothe the brain, and then the brain is no longer perceiving the signals from the body as a problem. So now the problem appears resolved and you end your treatment. And it is hard to get feedback from the patient, meaning it is hard to assess the usefulness of any other points or other strategies. When the skull points are taken out, it is possible that now the brain will start to perceive those body signals again as a problem, and now the treatment is deemed as not holding. This is why I prefer to clarify my strategy and check the effectiveness of all the points I want to use, and use the skull points last. This allows me greater clarity as to which strategies and which points work and likely to have a longer lasting effect. The next two strategies are utilized on the back. I always treat patients on the front first and then on the back. I do not do one-sided treatments only. undulating the spine is related in a way to the activation of the three diaphragms, as the purpose of activating the Chui action in the legs and the three diaphragms is to support the spine in order to tone the nervous system and modulate the yang up the spine. Here, I am looking at activating the areas of greater curvature or change in curvature. In a bow, the points of greatest projection, of greatest strength, are the highest curves. These areas in the spine are T11 and T12, where the lordotic curve switches to become a kyphotic curve, and T7 and T5 area, the height of the kyphotic curve. L2, the height of the lordotic curve, is a very popular point, as this is Mingmen, but I do not find it as effective as T11 and T12 or T7 and T5. Instead, I will use bladder 52 to help stabilize the waist. I do use L5 quite a lot. I tend to use the Huatou, though it does not have to be between the vertebrae, but can be anywhere on the Huatou line where there is a puffiness, gumminess, or tightness. I tend to not use the dew line much. If I do use the dew line, it will be needled at an angle upwards, towards the cranium. The Huatou is needled either at a 45-degree angle towards the spine, upwards towards the cranium, or both towards the spine and upwards. I tend to needle L5 down and out towards the leg. Prior to needling the spine, you can free and support the spine by using the sacroiliac ligaments. Then I use Do2, needled upwards, to undulate the spine. Do2 will often free up pain anywhere along the spine and also on the left inner border of the scapula, representing the nervous system, as in the heart's pacemaker. The point between small intestine 9 and small intestine 10, taken slightly back into the torso, needled up and out towards the deltoid, is a very useful point to open the spine, especially the upper part of the spine. Yao Yan, the lumbar eye, the dimple on the PSIS, needled down and out towards the legs, serves also to open the spine, especially the lumbar spine. In some people, L5 is more effective than Yao Yan, while in others Yao Yan is more effective. Small intestine 9-10 and Yao Yan are also considered to supply blood to the arms and the legs, respectively. I add Do16 to give a sense of elongation to the spine in this treatment. There are times when more lateral occipital points will do a better job for that, and if that is the case, they should be needled superficially upwards along the skin of the skull. I use these remote points first to start activating the spine, then I use T11, T12, T7, and T5, activating the spine locally. Here are the sacroiliac ligaments. This is the green circle. However, it is quite difficult to find the space between the sacrum and the ilium on most people. The ligaments actually extend further to the side to attach onto the ilium, and there is a much more flesh here. It is just as, if not more, effective to needle here. Look for the ropey, almost ping-pong-like feeling, and needle 1 to 3 needles of these, aiming the needle towards the middle and perhaps slightly upwards, as if you're aiming the needle towards L5 or towards the opposite gallbladder 26. On some people, you will also find ropey tightness just below the iliac crest. While these are not the sacroiliac ligaments, they serve the same stabilizing purpose for the spine. They can be needled in and up towards the crest. The final strategy that often has a higher priority than our organ or channel diagnosis is to ensure the circulation of the lungs and heart. This is what we term the zhang qi. One can make the argument that ensuring the pumping of the lungs and heart are related to the activation of the chest diaphragm, and make this way a complete case for the centrality of the three diaphragms, or the three Dan Tians. This is a nice argument and certainly ties up all the loose ends into one theoretical model. But I personally see this as a separate task than the activation of the diaphragm. Here what you see is the thickening of the tissue between the shoulder blades. On the left side, we see it in cardiac issues, and on both sides, we see it with lung issues. In cardiac issues, on the left side, it will tend to be more adhering to the inner border of the scapula. With lung issues, which can be both sides, it will tend to come further, both on the inner border of the scapula, the outer bladder line, as well as more towards the spine, as in the inner bladder line, and even closer to the wattoes. It is above the diaphragm, level of say T2 to T7, from the inner border of the scapula, and it can extend inwards towards the spine, especially in lung conditions. In many cardiac cases, left small intestine 11 will be puffy and sore. I start the treatment by opening up the upper thoracics with small intestine 9-10, needled up and out towards the deltoid. I also use DO2 to release the left inner border of the scapula. I stabilize the waist with bladder 52, needled towards the spine. Before I apply the tissue surrounding the lungs and heart and increase circulation and mobility of the chest, it is important that the waist, where there are no bones to automatically support it, that the waist is stabilized so that the extra pulsation movement we hopefully gain in the chest will not overwhelm the support underneath at the waist. In TCM terms, we might say that this is ensuring the kidney fire is moving up, or that water-fire communication is clear. Now I can needle the gummy areas on the inner border of the scapula. They are needled out towards the scapula. Direct moxa is very helpful here to dissolve the gummy tissue. If small intestine 11 is puffy also, then surround it and add OQ, direct moxa, to the needles. These are what I call preliminary conditions that need to be treated before we delve into other conditions, as they set up the stage, the human space, that which communicates between heaven and earth. If these issues are not addressed, the space, the vessel, is likely to keep impeding and affecting other conditions, affecting the organs. Some people might see these as primarily structural and feel that the resonance is more with function of organs, tissues, and cells, with the metabolic processes of the body. However, chemical reactions, metabolism, and function are affected by the condition and space that they are in, by gravity, etc. In meditation, one goes through some preliminary practices as one starts one's meditation. Typically, one would first establish the commitment to being here, meditating for the next X amount of time. Otherwise, one might constantly be drawn to having lunch, going to the movies, or balancing the checkbook. Then one establishes the posture, physically, by releasing tensions in the body while establishing an easeful upright posture. Mentally, by letting go of tensions in the mind while also paying attention, establishing one's awareness and concentration. One establishes some sense of spaciousness, ease, and joy, and then one can opt for any kind of meditation of one's choosing. Perhaps it will be awareness of the ever-impermanent and changing breath. Perhaps it will be generating loving kindness. Perhaps looking deeply into one's angers or fears. A koan, or meditating on great spaciousness, or the interconnectedness of all things. But first, there are the preliminaries, the establishment of the meditative space. In the Tibetan traditions, there are further 4 thoughts that turn the mind towards the Dharma, even more preliminaries. Regardless of the practice one might choose to do that day, and the Tibetan Buddhist traditions have multitudes of practices, different kinds of medicines for different states of mind. One always starts the practice with the preliminaries, contemplating that one has a human life that is indeed precious, that all things are impermanent, and one's own death is inevitable, that all actions have consequences, and that the world of samsara is unsatisfactory, and hence provide us with a motivation to practice. The strategies I offer here are like the meditation preliminaries. They set the stage up for the rest of the treatment. Sometimes all you need to do might be one of these, like, say, help the patient establish the chui, and then everything else will roll from that on its own. Sometimes a meditator simply enjoys coming back to the breath and establishing space within them. At other times, one might have to add more treatment strategies after the so-called preliminaries that have been addressed. This is done at the same treatment. It is not as if you do a preliminary treatment and then months later you can graduate to, say, treating the kidneys. Not at all. You address these preliminary conditions and immediately keep going and addressing in the same treatment your other diagnostic findings. But these treatments should improve the effectiveness of the rest of the treatment. There are also times when you will start treating an organ or a channel and recognize that it's not as effective as you like, and then you go, whoops, maybe I should release the neck. And when you release the neck, your other treatment starts being much more effective. So it's not as if you have to do the preliminaries first, but it's often preferable that you do them first. I hope you enjoyed this presentation and that you will find it clinically useful.